Okay, so I want to begin by acknowledging that we are gathered on the traditional, ancestral, unceded, and occupied homelands of the Coast Salish peoples. We also want to acknowledge that others may be joining from different traditional homelands today. This acknowledgement is a reminder of the discriminatory, racist, and colonial practices that have had a lasting legacy and continue to create barriers for Indigenous peoples in the healthcare system. Just want to read over this disclosure. Prescribing is a clinical act requiring the prescriber to exercise professional clinical judgment, taking into account the patient's clinical history and other relevant circumstances, including relevant guidelines and protocols and professional standards. Guidelines for the prescription of clozapine and its management vary between regions and organizations. The learner is responsible for ensuring they familiarize themselves with other relevant regional organizational guidance and/or protocols and apply appropriate professional judgment. BC Centre for Excellence in HIV/AIDS, the Treatment Optimization of Psychosis Collaborative, the Planning Committee, and the presenters assume no responsibility or liability in the use of guidance contained in this session. We want to take a moment to thank our sponsors. Without this, we wouldn't have been able to do this work, and that's the BC Centre for Excellence in HIV/AIDS, Vancouver Coastal Health, BGH UBC Hospital Foundation, and BC Schizophrenia Society. I'm joined today by our top core team. This is Harish Neelikant, our medical lead, Philip Charlebois, our operations lead, Jessica Ananuevo, clinical educator, Darwin Lai, QI coach, Angie Semple, our project coordinator, and Randall White, who's our project sponsor, but has been very supportive and very active in all of our regular meetings. And we're very thankful that the time he has dedicated to support our team. So the agenda was circulated before today, so I won't read these, but these are the learning objectives for today. And really the purpose of today's session is really to celebrate the successes that each team has made, to share some of the challenges we've had and also things that have worked, so we can continue to learn from each other and continue to build this community of practice, and then start to look at our next steps, ongoing resources, and looking at sustainability plans. I now want to introduce our first speaker for today. We are honored that Elder Glyda Morgan is here with us this morning. She's a First Nation elder, and she's from the Slayman Nation. And she's here to provide a welcome and to help us open the session in a good way. We thank her for her wisdom. Elder Glyda, over to you.
Good morning, everyone. And it's a beautiful day. And I just want to acknowledge the sacred land that I'm on. And I raise my hands in gratitude to the Musqueam, the Squamish, and the Tsleil-Waututh for allowing us to have our beautiful virtual circle on their unceded territories. It's a great honor to be here this morning, to be with the top collaborative. And I just, again, want to raise my hands and congratulations to all, and for the ones receiving awards, and for all of the good work. This organization is so close to my heart, as I do have a family member that has Axis 1 illness. As our lovely host introduced me, I'm Elder Glyda Morgan from the Squamish Nation, my mother's people. And my father is Hemelco, relocated from Church House, BC, mouth of Butte Inlet to Campbell River. And on this beautiful day, I would like to bring us together in song. And as you hear the words, just think of the beauty that each of you bring to each other and to the people that we serve. Coming together in song for the healing of our people, for future generations and all nations, coming here to find compassion for ourselves. Hey, 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 coming here to find compassion for ourselves, coming together in song for the healing of our people, for future generations and all nations, coming here to find compassion for ourselves. Emote and coming together, finding compassion for ourselves is so vitally important. And I just want to offer a prayer and inviting you to pray in your own way. Creator, we give thanks for this beautiful day and the gift of life. We give thanks for bringing us together at this time. I'm asking for prayers for all of our animals, for the ones that fly, for the ones that swim, for the ones that crawl, and for the two-leggeds and the four-leggeds. I am asking for prayers and blessings for our missing and murdered Indigenous women and girls, and for all of the recovered remains of our Indian residential schools across this country. It's 10,000 plus now. I'm asking for prayers also for our people that have no food, the ones without food, and prayers for the ones without homes. Praying for the ones that have gone through the floods in this past year and the fires, the opioid crisis, and the COVID pandemic. I'm asking for prayers for the ones that are in the war in Ukraine, in Europe, asking for prayers for them to have peace. Creator, again, I'm asking that any negativity be removed and invite in positive energy. And it's such a good experience, and we can receive and share with respect, kindness, and gentleness. I'm asking this in a good and humble way as we move forward with this day. And again, I'm asking for blessings for each of the people here that are doing the good work and sharing and serving our people. And I raise my hands in gratitude to all of you. Emote squy again. Oh, CM. Oh, CM. Thank you so very much. It's been my great honor to open for this morning. Thank you. Oh, CM.
Thank you so much, Elder Glida. We really appreciate you joining us today and doing that very special opening.
Thank you kindly. Have a good day, everybody.
Thank you, you too. All right, I'd now like to introduce our next three speakers that will deliver a few words of opening remarks. Our first speaker is Dr. Julio Montana, who is the Executive Director and Physician-in-Chief at the BC Centre for Excellence in HIV/AIDS, the head of the HIV/AIDS program at St. Paul's Hospital, Providence Healthcare, the UBC and St. Paul's Foundation Chair in AIDS Research, and UBC Killam Professor, Faculty of Medicine at the University of British Columbia. Over to you, Dr. Montana.
Sorry, can you hear me now?
Yes, we can hear you.
Thank you. Again, I want to thank you all for giving me the opportunity to come in front of you today. This is an important session, and it gives us an opportunity to celebrate the success of the collaborative to date. I want to first acknowledge Elder Gilder Morgan for her words and thank her for her introduction, as well as to thank both Chapman and Michael Norbury for joining me in this introductory session. As I said, when we launched this collaborative, strong partnerships like these leverage our collective strength so we can be more than the sum of our parts. We are really grateful for the trust that you all place on us as partners in this endeavor. So I want to particularly thank Vancouver Coastal and Vancouver Community Mental Health Services, as well as the British Columbia Schizophrenia Society for joining us in this effort. Similarly, I want to thank all of you who participated in this collaborative, because without you, none of this would have been the success that it has been. Throughout this pandemic and despite many obstacles, you all continue to develop your professional skill set by learning and working together to move this agenda forward. By doing so, we are now collectively better able to serve our communities. And hopefully soon we can gather in person once again for events like this and celebrate together in a more traditional fashion. The aim of the top collaborative was to increase the system-wide optimization of antipsychotic treatment in community settings. And thanks to the work of every top participant, we're now closer than ever to achieving this goal. About 10 years ago, the BCCFE published its findings about the effectiveness of a treatment as prevention strategy, originally targeted to control HIV, and since then expanded to a number of other fields, whether it's COPD, diabetes, hepatitis, and a number of others. This effort here is the first attempt to expand that type of strategy to mental health. The strategy, originally a hypothesis, became a real policy game changer, and now is widely applicable, not only in Vancouver, British Columbia, Canada, but elsewhere. Treatment as prevention, in fact, has now inspired the 90-90-90 target that the United Nations adopted about 5 years ago as the roadmap for the control of the HIV epidemic. And I'm delighted to report that as of this year, the 90-90-90 was replaced by the 95-95-95 target as we originally conceived. And the United Nations once again has unanimously ratified this as the global roadmap to control the AIDS epidemic by the year 2030. An ambitious goal, but something that it can be done if collectively we work towards that objective. The strategy was successful in British Columbia. And as you probably are well aware, we now have surpassed the targets of 90-90-90 by 2020, and we are well on our way to actually achieve the 95-95-95 before 2025, which would be the desired objective in order to drive us to controlling the epidemic in BC by the year 2030. As a result of that, British Columbia has seen the lowest ever rate of new HIV infections in the last year. Both morbidity, mortality, and transmission are at the lowest point ever. Early projections suggest that this year we are going to see even a further reduction on new HIV infections in British Columbia, something that we are really delighted and very proud of. The top collaborative follows the treatment and prevention strategy, and within it, it has a strong component of quality improvement, as led by my good friend and collaborator, Dr. Rolando Barrios. By using these successful blueprints and by working as a team, the treatment optimization of psychosis strategy has achieved a very significant level of success not previously seen in this field. We started this project with specific goals in mind, and Rolando will tell us more about it in a moment. We're very proud of the success to this date. The successes are really attributable to you, to the strong partnerships that we have been able to establish, to everybody's enthusiastic participation and the implementation of evidence-based practices. From the time TOP started until now, you have collectively taken the time and energy required to learn how to best care for those living with psychosis. You heard from experts who have dedicated their careers to helping those living with psychosis. And you have heard from those living with psychosis about what works for them and what doesn't. And collectively, we have learned from each other about what it takes to optimize the care for people living with a condition that has far too often been stigmatized and neglected. Now, at the closing Congress, everyone gathered here knows more about clozapine and its potential to help those living with treatment-resistant psychosis than ever before. Everyone here has learned how to best administer this medication to people who need it most, where they need it most. By changing the strategy regarding the initiation of clozapine to community settings rather than in hospitals, we're now able to deliver much needed care much closer to home in a much more effective fashion. So in closing, I want to thank you for being part of this collaborative. I thank you for your effort to learn and grow and for helping to improve the quality of care for everyone living with psychosis in BC. And we look forward to continue to work with you to ensure that this effort continues to deliver for all those in need. Many thanks.
Thank you so much, Julio. And now I'd like to introduce Bob Chapman, the Vice President of Vancouver Community at Vancouver Coastal Health. In his role as Vice President, Bob's responsible for providing leadership support to the operations team and community health services through a number of community health and programs, including home health, mental health, substance use, primary care, and long-term care. Bob's keen passion for and ensuring that VCH Community Services continue to meet the changing needs of our clients is evidenced in the support he has provided over his with VCH. Over to you, Bob.
Great, thank you. Can you hear me okay? Okay, great. Thanks so much. Thank you, Elder Glider, for that wonderful start to our session, and Julio as well. And to everyone for taking part today. I'm really proud of the work that we've done here, and I'm really proud to be part of this process in the Congress with our partners from the Center of Excellence and the BC Schizophrenia Society. I think it's been a very challenging 2.5 years or so since COVID, and the impact on our clients and our staff has been profound, as well as our public. And it makes it even more impactful when you think about us starting a practice change initiative right in the middle of this, which is not easy. Change is not easy at all. In the context of what was happening with COVID, I think that's even more of a success story. So it's been a very intensive year, 11 teams, 15 psychiatrists, 2 physicians.
I'm so sorry, Bob. There's a bit of an echo. I'm not sure if you want to mute and unmute and see if that makes a difference.
I'll try. Thank you. I'm in a very small breakout room, so I don't know if that's the problem. Can you hear me?
Yes, it's much better now.
Okay, thanks. About 70 people in total have taken part in 17 learning events, Q&A sessions, and the top online course, which really helps us understand clozapine and how the medication can help those living with treatment-resistant psychosis. So I think we've come a long way in our goal. It's going to take a long time for us to completely change practice and increase our confidence in optimizing the treatment of psychosis with clozapine. But I think one of the things for me that's most impactful is that we are shifting the care to the community away from the emergency room and hospitals. And that really is ultimately our goal and aligns with our strategic values. So thank you and congratulations to everyone for your successful efforts and the high standard of care that we are striving for to actually provide our clients and patients with the right treatment for them at the right time in the right place. So thank you so much.
Thank you, Bob. I'd now like to introduce Dr. Michael Norbury. He's a Senior Medical Director of Vancouver Community at Vancouver Coastal Health. Following completion of his family medicine training in Scotland, Dr. Norbury spent several years working as a GP academic fellow and a GP health inequality fellow, during which time he also completed his master's in public health policy at the University of Edinburgh. He also serves as the associate clinical director, he also served as the associate clinical director for NHS Lothian's out of hours GP service for 4 years. Dr. Norbury relocated to Vancouver in 2015 and started working at Ravensong Community Health Center, serving medically and socially complex mandated primary care clients as a family physician. Over to you, Dr. Norbury.
Good morning, everyone, and thanks, Valeria, for that introduction. I'm going to keep my remarks short this morning as I continue to be in self-isolation with COVID-19, but I'm pleased to be able to join you virtually. I'm obviously representing Vancouver Coastal Health alongside the BC Centre for Excellence in HIV/AIDS and the BC Schizophrenia Society. I want to give my congratulations to everyone gathered here virtually for their months of learning, growing, and hard work. Those living with schizophrenia or schizoaffective disorder, as we know, have long experienced stigmatization and discrimination. And the work you have collectively put in over these past few months will help lessen that deeply ingrained stigma and will help those living with this illness. As I said when we started the TALK journey, transformation is driven by the many, not the few. And everyone here today committed themselves to exploring new ways of thinking. And being open to that growth lies, of course, at the heart of quality improvement. Our medical leadership team at VCH continue to be supportive of TOP. We see it as an opportunity to further support healthcare improvement within VCH and to build a community of practice. Furthermore, TOP is an opportunity for frontline clinicians, those who actually work in our community-based settings, to effect change in how we improve our systems. Together, we've increased the number of clients diagnosed with treatment-resistant schizophrenia. We've increased the number of clients being offered clozapine, and we've increased the number of new clozapine starts. We've been able to do this because the collaborative has empowered everyone involved to start making changes. By building increased capacity within each team, we're able to improve outcomes for our clients and therefore improve their quality of life. Clearly, although there is still a lot of work left in combating the stigma and discrimination attached to schizophrenia and psychosis, the work of the TOP Collaborative has objectively improved lives and increased our capacity to improve more lives to come. Thank you again for your continued hard work.